But we have to know the background that is preventing good pain management. And that's the growing of abuse or addiction or diversion of prescription medication. In a study by SAMHSA, Substance Abuse Mental Health Service Agency, that in 2007 they published the results from their 2006 National Survey on Drug Use and Health. And they found that now the misuse of opioids has now exceeded marijuana in our population greater than 12 years of age. Well, certainly that's a problem, major problem. But does that mean that our grandma, anybody in this audience, you, me, should not be treated for chronic pain because of the criminal activity of others with diversion, or the disease of addiction in others, or the misuse of these medicines in others? We have to separate these out. We must separate these out of who needs these medicines legitimately and who, if you have the disease of addiction, that you get the proper treatment. If you're committing a crime, then you're punished accordingly. Well, what is the source of diverted prescription medications? Well, certainly, if we look at the literature, there's thefts and losses, secondary to armed robberies, break-ins, employee or customer pilferation from pharmacy companies, off of trucks, or even in your local pharmacy. There's a growing number of rogue internet pharmacies. But what's interesting, though, a paper just published by Ted Cicero showed that the internet is probably a very difficult source to get Schedule II or Schedule III opioid medications. You get tramadol as much as you want, but it is very, very difficult. And so the internet is not a big supplier, in fact, a very tiny supplier of controlled substances illicitly, especially opioids, especially Schedule II and Schedule III. There's certainly international smuggling across the borders, whether it be from Mexico or Canada. And again, an interesting study by our next speaker and his former associate, David Jorgensen. When a pharmacy has thefts, they have to fill out a certain form to report those thefts. And under the Freedom of Information Act, the University of Wisconsin Pain and Policy Group tried to obtain this information, and it took them quite a bit of time to obtain this information. And what they found of the information that they could obtain is from 22 eastern states from the year 2000 to 2003, there were 28 million dosage units that were diverted, and 25% of these were opioids. And what's interesting, in all the data that they could find, all this data was from east of the Mississippi. So when I go west of the Mississippi, I want to know what they're doing right, because apparently there's no theft or diversion or loss of medicines west of the Mississippi. We all know that's not true. And we all know that this database is incomplete. But I have to say the following. The media focus on diversion stemming only from prescribers can hinder patients' access to care. We only see the stories in the newspaper of the diversion, not that they shouldn't be publicized, or the misuse of medicines, or the stolen medicines, or the traffic accidents. I'm not saying they shouldn't be reported. But there's no stories, very few stories about grandma having her life back with appropriate pain management. We're able to sit with her grandchildren on her lap and read Dr. Seuss, or somebody returning to work with appropriate pain management with rational pharmacotherapy. That story has to get out, because that's a predominant story. We do not want the tail wagging the dog. We want the dog wagging the tail. And the proper use of opioid medications, which I will go over, within a boundary before you write the first prescription, could be unbelievably helpful to the patient to improve their life by decreasing pain, increasing function, and monitoring for any side effects.